When we think of psychiatric interventions, what we're talking about here is suicide, dealing with combative behavior, as well as issues of capacity, competence, etc. When we're thinking about suicide, to do a complete assessment, you must inquire about three specific areas. Number one is suicidal ideation, meaning, do you have thoughts of committing suicide? Number two is suicidal intent, meaning, are you serious about committing suicide? And number three is, do you have a suicidal plan? Of course, all of them are important in assessing suicide, but the most serious ones would be intent and plan. It's very normal for a lot of people to have thoughts of suicide, but not necessarily have any intent or any plan. But all of these must be clearly assessed when you are determining what to do with patients, when you see them in the hospital, when you see them in the office, in determining their treatment plan. When we think of the presentations of suicide, what you also have to consider is that people who have attempted suicides and failed are more likely to reattempt again. So most individuals who have attempted will retry within 3 months of the first attempt. It's also important that you ask patients about their thoughts of suicide. Another myth is don't ask patients about suicide because that will put ideas into their head. As well as people who are suicidal will not talk about it. In reality, people who are suicidal do talk about it. So you will hear these patients talking about suicide, and that should be one of the warning signs. Also, people who are suicidal demonstrate suicidal behavior. For example, they give away their possessions. They write a will. They try to finalize everything in their lives so that when they do commit suicide, everything is taken care of and no one else has to worry about anything. Risk factors for suicidal behavior include previous suicide attempts and/or threats. A lot of times, patients have a feeling of helplessness and hopelessness, which basically will increase the risk for suicide. Also, any kind of psychiatric illness or drug abuse will increase the risk. We know that males commit suicide more frequently than females, and we know that females attempt more frequently than males. Elderly, especially elderly white males, are your number one risk for suicide. People who live alone are more likely to commit suicide. People who are unhappy with their jobs, people who have chronic physical illness, people who come from a higher socioeconomic status are more likely to commit suicide. Those that are unemployed are more likely to commit suicide versus those that are employed. Separated, widowed, divorced are a group of individuals who basically are alone, and these are the individuals that are at high risk for suicide. Being single is a moderate risk, and being married is a low risk for suicide. When you look at professionals, the number one at risk for suicide will be dentists. But when you look among the physician groups, then of course psychiatrists will be number one, especially female psychiatrists are at highest risk for suicide. Now, when we also assess suicide, we want to make sure that we will admit these people until further evaluation is completed. So if you wonder about suicide, you are not sure the patient will commit suicide, the safest thing for you to do is admit the patient, complete your examination, and then make your determination of whether you can discharge that patient or that patient needs continued hospitalization. You must take all threats seriously. You must question about suicide. What are their plans? Have they done it before? Do they have a family history of suicide? Do they know anybody who's committed suicide as well? And if they do, how did that person commit suicide? The more information you know, the better off you'll be in trying to understand that patient. Don't identify with the patient. What if a patient has a terminal illness and wonders about suicide? Never say to the patient, if I were you, I'd kill myself as well. That is something that is totally wrong, and that would mean you're identifying with that patient. So when we determine whether to admit a patient or not will be based on the risk factors involved. The more risk factors involved, the more likely that you should admit these individuals. So if they have mental illness, if they are elderly, if they are male, if they've tried attempts, if they've had any kind of other disorders, that individual should be admitted for their own safety.